I'd like to extend a very warm welcome to the Leader of the Council, the Deputy Leader, Councillor Clark and Councillor Little, and all other officers joining us today, as well as our representative of the Local Democracy Reporting Service. I can't see any members of the public here, but if they are here, they are very welcome as well. There are no fire alarms scheduled for this evening, so in the event of an alarm, it's the real deal, and do please leave in an orderly fashion. Please be advised that this meeting will be recorded and subsequently uploaded to the Council's YouTube channel for public viewing. Members are kindly asked to raise their hands when wishing to speak to ensure a smooth recording process. We've got an important job to do tonight, which is to scrutinise budget proposals. And as such, as you all know by now, and I can count on all the members of this committee to do, I'm expecting that party colours and allegiances are left at the door. Our role is to be a critical friend to the administration and to make constructive points of criticism, not to score political points. The scrutiny recommendations made tonight will go to Cabinet in February before final recommendations of the budget are made and are presented to full Council on the 23rd of February. And with that, let's begin with agenda item number 1. I am not aware of any apologies for absence, but were there any apologies which should be reported? Thank you very much. Item number 2, I'm not aware of any appointments of any substitute members. No? Okay, thank you very much. Agenda item number 3, declarations of interest. Do any members have any interest to declare under the Members' Code of Conduct? Okay, I'm taking that as a no. Thank you very much. Agenda item number 4. This is to confirm and sign the minutes of the meeting held of this committee on the 3rd of December 2025. That's pages 4 to 18 in your packs. Can we confirm that these minutes are an accurate record? Is there any amendments people would like to propose? Members would want to oppose? Okay, well, I shall sign those for you afterwards, Karen. Okay, agenda item number 5, which is the public forum. Can I remind everybody that the purpose of the public forum is to provide an opportunity for members of the public to raise matters that relate to the proposals set out in the medium-term financial plan as submitted with the agenda papers. I can't see any members of the public here at the moment, so I'm going to close that section of the meeting and move on with the main business of tonight's meeting, which is agenda item number 6. So agenda item number 6 is the medium-term financial strategy, which you all have had a chance to see in the papers and the subsequent slides that have been sent out. To ensure a clear and orderly discussion, and given the broad remit of this committee, each directorate's budget proposals will be considered in turn. This approach is intended to avoid questions being raised across multiple service areas and to provide a clear structure to the meeting. The sequence for consideration will be as follows: children and young people, adult social care and public health. Following the discussion of the children and young people budget proposals, there will be a short comfort break. During this interval, please be aware that the recording will be carrying on and microphones should be switched off. If you wish to have any private conversations, please leave the chamber. And I will just point out at this moment that there are some refreshments at the back of the hall. I can't guarantee that they are nutritious in nature. They might just keep you going. Please do help yourself should you wish to. And with that, I'm going to hand over to the Cabinet members and officers from the children to present the children and young people budget proposals. Problem at all.
overview. The social care and wellbeing group budgets comprise general fund, capital and revenue budgets. Public health is ring-fence revenue account, which I'm sure a lot of you are aware of. This is the first year that we have done children's, adults and public health in one group. The budget report and detailed financial information has been circulated to Scrutiny Committee members in advance of the meeting to scrutinise, and the information sets out the 25-26 budget position, the proposed budget position of 26-27 and the supporting information for budget recommendations. Financial sustainability is challenging within social care due to increasing demands and funding challenges, which again, you're all on the committee, so you will understand that both adults and children can be unpredictable. We can all of a sudden get a something passed over to us quickly. There could have been an accident or something where all of a sudden we have to put a lot of money in and it pushes us over the budget. Investment in 26-27 to transform services that ensure more children are supported in Dudley. So the key priorities for the group overview is to complete and implement review of group target operating model associated structure, to achieve and maintain legislative and regulatory compliance across all services, and to deliver services in line with the group budget. So as you will see, and you will have already had these slides, the approved budget and the forecast and the variance. Yeah, please. No.
No.
Back to me. That's it, the next one. So key priorities for adult social care is delivering the remodel within budget, which will start off with the staffing and structure, and then phase 2 will be the provision and the services that are provided. Improving and sustaining our partnership arrangements with Integrated Commissioning Board, Dudley Group, NHS Foundation Trust and community and voluntary sector. So it's continuing those conversations with all to make sure that we are continuing to co-produce. Development of resilient communities. So again, that is working with the voluntary and the community sector and making sure that we're aware of what is going on around us and what people need, and that we're delivering this. Delivering continuous development plan in line with CQC inspection outcomes. That is something that we will continue to do. We may have to add to it when we get the result back from the CQC, but that obviously is something that is continuously being monitored. Development of commissioned services, community equipment, supported living placements, extra care, bed-based respite. There's a review of the services that are being commissioned to make sure that everybody has the best service possible to them within Dudley. And then improved use of technology to improve business operations to support people with lived experiences. So the budget overview. The service is progressing a restructure to align to the new operating model and to ensure provision of effective support. Sorry, apologies. The project outturn for 25-26 shows a forecast underspend of 2.487 million, largely as a result of lower client numbers. This also does include money that has come back from direct payments that has been recouped. So obviously that is not going forward. We're still going to have to keep finding the money because that is just a one-off this year. Budget provision for 26-27 includes recognition of not only expected inflationary uplifts for external contract provision, but also of demographic pressures, noting overall increases in client numbers, based on national and local data. So that is something else that we want to put more money into, to make sure that we have the correct data so that the right services are continuing or coming forward. And I think I missed one out before that. Oh, providers have taken on the higher employer national insurance contributions from April 2025, but rates have not during 25-26 seen the full impact of this change, and that's likely to materialise in 26-27. So that is something again that we need to keep our eye on, because that will have a knock-on effect of the costing next year. And an area of focus continues to be the level of contributions from health in relation to continuing healthcare assessments and other contributions from the NHS. Investment of 26-27 includes development of the reablement service, which is expected to reduce long-term home care costs and enable more older people to continue to live independently for longer. So that is something else that we are really working hard on at the moment, is the reablement service. So we've got the prevention. And then you can, Wayne, all yours, mate.
Well done. Just 1 second, just for a bit of clarification. Thank you for that presentation, Councillor Goddard. Have we just heard the budget proposals for adult social care? And have we just heard the budget proposals as well as public health? Or are we just going to hear those separately?
I'll come in with public health after children's.
Oh, okay. Just 1 second. If it's okay with you, Councillor Goddard, how we envisage the session, just so everyone's so we can kind of follow the thread a bit easier, is after each presentation we hope to take some questions. So if it's okay with you, I'm going to open up questions to the committee for this slides that you just presented on, if that's all right. Councillor Baton.
Thank you, Chair. So I've got a question around the underspend, and I suppose I just wanted to understand on the 2.87 million underspend or something like that. Yeah. So is it as a result of fewer people being assessed as needing support? So has the criteria changed, or are we having lower numbers actually coming through? And I suppose when you consider that we're an ageing population, speaking here personally, you know, it just seemed a bit of an anomaly if the numbers are less and reducing when actually we're an ageing population.
Yeah, that was something I questioned myself, because it seemed a bit odd. No, to be honest, the majority of the underspend is from a recoup from the direct payments that we got back, because a lot of people weren't spending the money that were in their accounts. A lot of them were really frightened over it, actually, that they got money in their accounts that they shouldn't have had. That all came back, so that pushed the money up considerably. But it's not through lack of assessment. It was from what? Sorry, the curve. Oh, yeah, the curve. So after COVID, I'm so sorry. So after COVID, it really, well, just before COVID, obviously, during COVID, it spiked. And then a couple of years after COVID, it all of a sudden took a big dive. And now it's kind of like plateaued. So we're actually just sort of like going back to normal as pre-COVID sort of thing. So that's where that money is, if that makes sense to you.
Can I just come back in, Chair? So unravelling that, we basically are back at a baseline where we were before COVID. Yeah, right. And I suppose then I'll come back because I've lost my train of thought.
I've probably done that to you. I'm so sorry.
It's all right. It'll come back to me halfway through Councillor Little's presentation. So I'll then have to interrupt you to ask Andrea.
Just write it down. Then
yeah. I'll come back to it.
Anyone else indicating to ask questions? Councillor Henney.
Thank you, Chair. On growth and pressures, on your slide. You mentioned that the growth model assumes 2% annual growth in assessment and independence and 1% in disability and mental health. What evidence supports these assumptions, and what is the financial exposure of actual growth exceeds projections? Yeah. You want me to read that out again, or are you okay?
But it's from the bigger set of slides, it's on a different notes. So I'm trying to, basically the data that we've got is from the Office of National Statistics. So that's what aids us with that kind of a surety. What was the last bit you said, sorry?
The last bit on that was, what evidence supports these assumptions?
Yeah, so it was evidence-based from the Office of National Statistics, so the data from them.
Okay. So just to follow up to that then,
Yeah.
What is the sensitivity analysis? As an example, what happens financially if growth is 3% rather than 2%? What will happen?
Can I get finance to come in on that one? Because
Please do, yeah.
Hi, good evening. Can you hear me?
Yes.
Yeah, okay. So as with every budget, we make a number of assumptions in terms of what growth, what demand might be in the future, and that is across the board. And obviously, we don't know what that will be, but we use various sources in terms of, as we've heard there about the ONS, we look at population data, but we also look at trends internally as well. And we will make a judgment call on what that looks like, not just in terms of numbers, but also in terms of mix, because there's different client demand that comes in different places. But at the end of the day, it's not an exact science, and we all recognise that, and there will always be variances throughout a year. What you'll see, though, in our budget strategy is that within the overall budget strategy, not necessarily within the service itself, but we do provide contingency, and we do monitor on a monthly basis to see where demand and cost pressures may vary in terms of what we've assumed and what the reality is. But we've built in quite a reasonable contingency within the overall council budget, so that we've got something there if demand exceeds the budget. So from my point of view, I need to do, as part of the budget setting process, a Section 25 statement, and that looks at financial resilience. It looks at, what would happen with those in that sensitivity analysis type scenario. What could that cost pressure be? So it's baked into the overall strategy is really what I'm trying to say.
Anything else, Councillor Hanif? Councillor Bevan?
Thanks, Chair. It's only a quick one for me. So the slides show a 10.3 million increase in the budget. Just out of sort of idle curiosity with that, how much of that increase is driven by inflationary pressures versus genuine service growth? So that is that increase driven by inflation, or is that driven by service growth? Yeah, so the 10.3 million increase, how much of that is driven by inflation? So us seeing that increase, is that inflation that's caused us to have to put that increase in? So we're putting more money into that as a result of inflation, or is that genuine service growth?
So if I may, Chair, just answer that question. The growth in the budget is, as you say, made up of both demand growth, but also around inflation. And the report that was presented to Cabinet on the 10th of December sets out what inflation's being added. And for social care and wellbeing for adults, 5.8 million is inflationary pressure. A significant amount of that is directed towards our external providers for care.
Perfect, thank you. Thanks, Chair.
Anything else, Councillor Bevan?
No, that's everything. Spot on.
Back to you, Councillor Ayton.
Just a guidance from yourself, Chair. When are we questioning on the workforce summary? Will that be a separate presentation, or are we raising questions around that summary now?
Who's due to give that presentation? Has that presentation been? Okay, well, I think we can ask those questions now if there are officers in the on that side of the chamber who are able to answer them. So please, by all means, Councillor Baton, if you have a question on the workforce, please do bring it forward now.
Okay, thank you. So, I mean, both on the workforce as a whole and the group workforce, it's very noticeable around the reasons for sickness by full-time equivalent losses. The highest ones are mental health and work-related stress. Do we think that there is any direct correlation between the reduction in headcounts for both the staffing as a whole or the group staffing, and the additional work that would assume that people, existing staff are having to take on? Because I mean, at one time, perhaps going back 5, maybe 10 years, the predominance of absence would have been musculoskeletal. The predominance of absence now is stress-related and mental health related. So is there are we seeing a direct correlation with information coming back from HR with that? And if so, what are we doing? What are we doing to address that?
Chair, could I come in there?
Yes, please. Thank you.
Yeah, thank you. Thank you, Councillor Baton. So we wanted to present the workforce slides because you've asked for them previously, and we felt this was an important place to present them. So yes, mental health, anxiety and depression are, as you can see, the top reason for sickness. That through the support we give staff through our counselling service, through the support through occupational health, does demonstrate that the stress and mental health anxiety is a mixture of home-based pressures, challenges around caring responsibilities, etc., all of which we are looking to address through our policies and how we can reflect them. In terms of work-related stress, again, we're putting support measures in for counselling to see how we can support. Some of that is around retraining our staff around using technology better, automating services so that we have less manual intervention. The last few years have been challenging for the council with the budget situation we have, but as you can see, the finances are stabilising, so that allows us more to invest in the workforce, and we certainly are starting to see those trends turn around. But what you've got there is the figures for quarters 1 to 3, which we wanted to show you. Thank you.
And thank you for that. And I hope that when we were doing this process in another 12 months' time, because we can see quite a significant increase on sickness long-term days lost on the group, in the group numbers, from 8.93 to 11.57. So hopefully next year we will actually see some positive impact that the things that are being put in place from the service are having that desired effect. So yeah, I think we'll be picking that up in 12 months' time as well.
Yes, thank you. And Chair, through yourself, it is our aim to provide this information regularly so that, again, it can be scrutinised, and also members can see the direction of travel. So, for example, in the overview for the group, the adult social care redesign is being co-designed with the staff and our partners, so they feel part of it rather than it done to them. So we are hoping that rebalancing of where the capacity is needed will help to support this. But I hope you feel that this is a good summary and gives you something to compare against, and we will produce that regularly. It just felt appropriate that Scrutiny should see this. Thank you.
Thank you, and thank you for the transparency on display there. Did you have any further questions, Councillor Baton, on this? In that case, Councillor Ridney.
A comment, really. In past years, we have had reports on occupational health, etc. amongst staff. I haven't seen one for quite a few years. Perhaps that is something in the next year to bring to the committee on the overall support that we give to our workforce across right across the council itself, not just in particular in adult social care and children's service, but I should imagine the highest. I mean, this is off my head here. The highest number of people employed are in those two departments, I would have thought. So it might be, having not seen one for a number of years, that a report comes to some scrutiny this year about occupational health, where it's going, what direction and what we're doing and what support we're still giving. Thank you.
Yeah, thank you, Chair. Through yourself, what I would propose is, rather than wait till next year, we can give you a report that summarises all the staff support we do around staff benefits, counselling support, how we review that, the occupational health review, and provide that. And it could go to the Core Business Scrutiny Committee as part of next year's work, maybe in Q1 of 26-27. But I don't think we should wait for that for members to receive that of this committee. So I'm happy to take that as an action. Thank you.
Anything else, Councillor Ridney, on that point? Thank you. Well, I'm looking around. Is anyone wanting to raise any further questions at this point? In the absence of any questions, while perhaps people are putting their thinking caps on, I do have a question, and it's probably best directed for finance, Lisa. So I'm no mathematician. I got to see at GCSE, but so following this process, one of the things that really did leap out to me was the forecasted, and I do accept that it is a forecast and an estimate, that there will be a gap next in 27-28 of just over 5 million, and then which would increase to over 27 million by the end of the decade. So I guess I'd just be good at this point, if appropriate, and do advise if inappropriate, what measures are being taken to help safeguard against such a large gap. So I think all councillors, regardless of whichever group they sit in, would not like to be in a position like we were in last year when we were forced into making some really quite unpalatable decisions. So if you're able to answer that, Lisa, or perhaps Councillor Clark, I'll be interested to hear from you.
Yeah, no, you're quite right. And we did two reports. We did one in December that sort of made an assumption in terms of what we thought the financing would look like before we got the draft settlement. And we've published a report that went to Cabinet last week that provided information in terms of what that draft settlement said, but also the impact on our medium-term financial plan. And you're quite right in terms of we're able to present a balanced budget for 26-27, which is the immediate issue, but we need to look at that longer term. And as you say, we've already know that we've got a budget gap in 27-28 of over 5 million, and that continues to increase to over 27 million by 2030-31. So I think from my point of view is, one, it's really important that we're doing that medium-term forecasting and we're looking ahead. So we're not just being short-termist in terms of what we're doing, but we've got something that's realistic that we can work to as a plan. So you'll also see in the report that went to January that we talked very much around transformation. And we are building in terms of 26-27 some funding into a transformation reserve, which will supplement what we've got from flexible use of capital receipts. But I have to stress that money is just one off, and it can only be spent once. It's not recurring funding. So we are starting to look as a council in terms of that longer term transformation. How can we reshape services? How can we start to look at demand and make communities more resilient? But also at the same time, how we can reduce our cost base, just the cost of doing business. So things like streamlining our processes, just bringing costs down in terms of automation, better use of technology. They're all the things that we are looking at and planning to do. But obviously there's an urgency to do that because that gap 27-28 will be on us before we know it. So it is very much now about evidence-based business cases to access that transformation funding. It's about making sure that people are able to articulate what the benefit, the outcome of that investment would be. And from my point of view, it is very much that hard-edged around finance in terms of what will it do to bring our costs down and close that gap. And then lastly, I think it is about continuing to lobby for more money. We've seen the settlement. We've got a 3-year settlement. We responded to the consultation that was out on the fair funding settlement. That consultation closed last week. We're being told that we will have updated numbers on an annual basis. Whether or not they change significantly remains to be seen. But we will continue to make presentations where we can, or representations where we can.
Thank you for that, Lisa. Would anybody else on that side like to comment further on that point? Thank you. I think that's really positive, good to hear. And I'm sure when we come on to recommendations, we can acknowledge the fact that adult social care and children's services are two of the biggest burdens on this council's finances, and we can make some commitments around working together to ensure that our budgets continue, well, we can reduce any funding gaps as best we can. Any other questions for on the adult social care aspect? Thank you, Councillor Baton.
Just one on the review of telecare services to achieve efficiencies through income and operational reviews. And I see that the aim is the saving to be made in 26-27. So when's the review of services going to take place? And how are we going to mitigate against the risk that we saw the last time big changes were made to the way telecare services were charged and managed? We saw quite a reduction. And a reduction in people who actually still needed that service, but they chose to opt out of it. So how are we going to manage the risk? And when will the review be undertaken and complete to ensure delivery in the next financial year?
It's going to scrutiny next month. So that's when everybody will have a look at it.
Yeah, just to clarify there, we've added that to the agenda for this committee on the 4th of February. So plenty of opportunities to ask some questions there ahead of the budget. Anything else on adult social care or any other questions based on what's been raised at this stage? Speak now or forever hold your peace. Okay. In that case, is it back to you, Councillor Goddard, to present on public health?
I think
so. If you stay with that slide, it is good. We've just changed it around a little bit. So Councillor Goddard is going to present on the public health in a second. But just to give a little bit of a break and a recap of the committee and how we've had over the last 12 months, I wanted to just go back and refocus our mind and see where we are on terms of the target operating model and the associated structure. So this was a new role that I took on in May last year. And before, there were separate committees, weren't there? You all sat on children's and adults and the separate ones. And so this last, not even been 12 months yet, for us as a committee to get our head around the workload chair, that, you know, there's a lot of it to get around, isn't there, and understand that new model. But that's also a time for it to embed itself within our workforce as well. So when we talked about on that group-wide thing there about the group target operating model, this is a key priority, and the associated structure. It's worth bearing in mind that what we've just spoken about is about a budget going forward of investment. We're not sat here like we were last year or any years before this, and I asked some people tonight, is it sort of a one-off where we've actually got money going in at this point in time for a budget setting? And it's quite unique, and I think quite a positive thing that we're talking about this evening, where in adults they're making savings already, in children's we're investing so as those budget pressures in the future can start to reduce and deliver the outcomes for children. And I think aligning children's, adults and the public health is really starting in my role now to understand how that benefits our children in their life journey through in preparing for adulthood. And so it makes sense. And I think I just wanted us to focus on that we've had 12 months of getting used to how these three portfolio areas are coming together. Our staff are too, and the restructuring management and working together. I just wanted to frame that and say that from what we've had so far leading up to this 12-month period there's a lot of bedding in for the likes of our new Director of Services, John, Emma appointment. So this is a really exciting time, and the money that we're talking about this evening is investing so as we can reduce those pressures, Chair, in the future and deliver the right outcomes for our young people. And it's great to see the new structure in public health, having met with a new team there under Hema's leadership as well. So on that, I'll hand over to Andrea, who's going to talk a little bit about public health.
So kind. So moving on to the public health aspect, the key priorities in 26-27 is to support the transformation in line with the council plans and the NHS 10-year plan. So I'm just trying to think, the analog to digital, hospital to home, that sort of
plan.
Yeah. So Dudley are trying to align with that at the moment, and co-produce 3-year plans for Start Well, Work Well and Age Well, which is we're focusing on early. My gosh, I'm so sorry. From birth all the way to end of life. So if we can work with people from birth, especially the first 1001 days, which is extremely important, then so that's like with health visitors and school nurses, etc. Then it can help people move into adulthood and then continue to give them extra support during adulthood with nutrition and other sorts of activities, etc. Then we are less likely to see any ill health inequalities as we age, and we can keep people as independent as possible and to stay at home. The next is audit of commissioned services. So we are continuing to audit all services that we commission to make sure that we have the best outcomes across Dudley for our residents, and to prepare and participate on the Office of Health Inequalities and Disparities sector lead peer review of public health, including correct methodology for the reporting relevant officer. So the budget overview, the budget, I'm pleased to say, is nowhere near as bad as it was last year. And the overwhelming majority of funding for public health service is following the organisational redesign funded from the public health grant. Services such as environmental health and traded services, community forums and emergency planning, formerly managed within public health, are now with the appropriate group budgets. The public health grant for 26-27 has been announced at 27.481 million, which includes a number of previously separate grants relating to drug and alcohol treatment and encouraging smoking cessation. This represents an increase of 0.372 million or 1.37% compared to 25-26 baseline. For the first time, there is a ring fence within the public health grant for spend on smoking cessation and drugs and alcohol treatment, which is something that I welcome, because the prevalence of alcohol and drug abuse within Dudley is on the increase, and it's something we do need to put more time and effort into and more money into to reduce this. And I'm sure that working alongside the voluntary and community sector, we will find more and more people who are in need of that help. Many public health contracts are linked to NHS pay and conditions, with an uplift of 3% advised as consistent with the NHS agenda for change pay uplifts. Contracts are negotiated through robust procurement processes to achieve best value. And spend on public grants must align with required outcomes and will be monitored and reviewed throughout the year.
Right. Oh, yeah. We're not going.
Thank you very much, Councillor Goddard. I'm going to open up the floor to questions now. Councillor Ridley.
Yeah. I think it would be fair to say that public health's been at a bit of a standstill in the last 12 months. Probably more than a standstill, frozen in time, I think. One of my main concerns is what you just brought your attention to is about smoking cessation. And this is wearing both hats, public health and children's services. I was part of writing the smoking policy of the council some years ago with Rachel when we were on the health committee, and I don't think it's been reviewed since. But what has changed is the fact that we've now got more young people using other methods to smoke rather than a cigarette, and that's quite worrying. While some will say, "Oh, it's fine, it's not nicotine," it doesn't matter whether it's nicotine or not. You're still drawing not wanted products into your lungs, as you can hear. I have COPD, which everyone will tell you it's due to smoke, and I haven't smoked for over 30 odd years, but still paying the effects for it. But also there were other chemicals that I had to use during my working life. But I'm concerned about our young people. And I think if there isn't extra money to be spent on that we need to actually renew that campaign. We need to bring it out there, target it from our older people to our youngsters, stop them smoking as teenagers, then they won't become, when I in my professional life, used to get them in at 80 years of age saying they need to stop smoking. I used to think, well, at 80 years, if you got to 80, it's really, you've done pretty well. But let's stop them smoking at 12 and 13 and younger than that if we can. So let's make a real effort with public health this year to actually bring it prominence. Can you assure me that it's now in one grant, which is what you've just explained to us, but some of those issues that we've got with like smoking, etc., that what the outcomes are going to be, how we're going to know what's the impacts of some of those grants?
Yeah, I completely agree with everything you've said, and firstly, I agree with the fact that it's something that has just been ignored. It's been tried, it's been tested, it didn't work, so let's leave it and let's go on to something else rather than actually going back to something that is so that can affect you so much later on in life, which then has a knock-on effect on everything else. So yeah, the ring-fenced amount will go on alcohol, will go on substance abuse, and will go on smoking. We haven't put the framework together yet, but it is something that we're in the process of doing so that we can find the right way to combat this and to be effective to young children, because obviously this is something that we are starting within public health, that we are looking at the younger age, that everything needs to start at a younger age. They need to be educated at a younger age. So as soon as I know I know more, I will let you know. Is that okay?
Pravinda, would you like to contribute?
Yeah, I just wanted to just add to that. So, Councillor Ridney, you're referring to things like vaping that are the new trend that are coming in, and all the other things that smell like vanilla and taste like chocolate, but we don't know what harm they're doing. So, as part of our new operating model and the structure, teams like environmental health, trading standards are now part of our regulatory services, so that work that is about bringing all those bodies together to support the closing of those shops, the fast action that's targeted around those areas is done alongside in partnership with public health. So what I'm really pleased to see is that HEMA and the team are very much working in an integrated way with the remaining groups. So what we do with our communities and what we do through regulation. And I hope that councillors have seen that the awards our trading standards teams have won around this work and around some of the, abuse that vulnerable people such as people that are being cared for have had. But we've also been on the front foot and recognised nationally for the fact that we've closed vape shops much earlier than lots of other local authorities. So we are trying to get on the front foot, but it is a growing issue. I completely agree with you. And that's why this group being integrated with children's, adults and public health, and then having all the regulatory areas in one group makes it that combined effort that's much more powerful. Thank you.
Councillor Ridley, would you like to ask us?
Look, one of my other concerns is when we're talking about smoking, we have particular issues in Coes. We have a particular pub that has a smoking cover in the back in the yard, but they like to stand on the front steps, don't they, Dave? And everybody walking by gets a full whiff of tobacco. If we could encourage our partners, because this is not just about us, it's about our partners. We have people ring up and complain to us, and apart from us standing on the steps saying, put your fag out, there's not a lot else. We have to rely on the officers. I have to say, environmental health are very good. If you report them, they do follow up on it. But if we could get our partners to be a little more enthusiastic about the game, that would make it a lot easier, and it would make the extra money that's being put in actually make a point, make an impact. Thank you.
Thank you. My question is around the 3-year plan of start well, work well and age well. And there's been a number of plans in public health over the last few years. And I would hope that something like the poverty strategy will sit within that live well and age well programme. I think my issue is around how do we have reported to us the savings that these projects are aimed to deliver. So, for example, the poverty strategy, you would expect over a period of time to show a reduction in demand on the household support fund, because if all the work that public health are doing, it should relieve that reliance on those kind of grants and opportunities. So I suppose really obviously that the new 3-year programme hasn't started yet, but do you have targets in your mind at the moment about savings to the council in other ways that these kind of programmes will show, and savings to the health service, or what are the KPIs that will be put into this particular type of programme? Because I think without those measures, it's really hard to see to gauge the impact overall for those that rely on those in Dudley.
Whoever feels best placed to respond to that. Right.
If it's okay through you, Chair, I'll come back on that. So, Councillor Baton, you're absolutely right. We have to absolutely evidence the so what from these campaigns. And if they're not having the impact, because some of our campaigns, we have to accept, may not hit the mark with the communities and the way they want to receive support, you have to have it. So HEMA has recently, HEMA is our Director for Public Health, in case for the public. She has restructured the whole team. She has talked about how some of our leisure facilities are better, used for things like social prescribing and investing more in that. So we also have now, as part of the new operating model, a core business intelligence team that will produce the data that shows you the comparisons and the benchmarking and how we are progressing over the years. When HEMA's back, she's away on leave at the moment, and it was pre-booked leave for when she started, I will ensure that the KPIs, as they are developed, because this plan that we're producing for 3 years is still a plan underway. So as soon as those indicators are available, we will start to produce those so that you can see them at scrutiny. And just like the workforce statistics, I think KPIs like this, you should see. You now have the KPIs for the council that you receive and is a live dashboard. We are progressing for more and more on that. So absolutely, Councillor Baton, I'll take that away to the public health team. Thank you.
Councillor Baton.
Yeah, thank you and appreciate that. I think it's just making sure that we build in to understand what, and they're not short-term savings. I appreciate that, you know, this is their long-term plans, but so that we can actually see, is there a reduction in demand in key areas? Can health partners evidence a reduction in demand because of the work that the council has undertaken? But I appreciate that's not a quick answer.
Thank you. Councillor Hanif.
Thank you, Chair. You mentioned inequality, reducing inequalities. So as a priority, 2 areas that I want answering is what measurable outcomes will be delivered in 2006 and 27. You partially sort of answered this when you answered Councillor Ridney's question, and how will the committee know of the inequalities that are narrowing during the year, and how often inequalities are talked about, but not actually, nothing's done about them.
Thank you, Councillor Hanif. I completely, a valid question. However, I think this is ongoing information that we get from the voluntary sector, from the community sector and outside bodies and providers throughout the year where the inequalities are, and we rely on those sources. However, they come in at different times. And when they come in, that's obviously when we have to, you know, action something and work together to co-produce something to make sure that these inequalities are sorted, sort of thing. So, yeah.
Okay, thanks for that. Just a quick follow-up. Do you have any idea of which specific ones that might come through the year on our programme?
Well, it tends to be poverty, and it tends to be, you know, deprivation within certain areas, and we know which areas tend to be worse than others. So it's a case of focusing on those areas, and we, you know, in particular in the north of the borough, St Thomas's, St James's, there's quite a lot of issues there with different people, and it's something that we're trying to target at the moment by using different leisure centres to make sure that we've got enough information out there. We find that a lot of people don't want to actually openly ask for advice, or won't actually turn up anywhere because they're in fear of asking for asking advice. If they ask for the advice, they feel that they're either failing as a person, or they're going against, in some cases, their religion, so that they, you know, they're fearful. And it's about targeting those groups and making sure that they don't feel that they're failing. But the only way we can do that is to get as many people and as many partnerships on the ground to actually be finding out where they are. And that I think is a challenge that we have got within public health, is actually finding and being on that ground and finding all the different issues that people are hiding.
Councillor Hanif.
Thank you, Chair. I just say on that, just ensure that the committee is highlighted with, you know, in capitals or whatever during the year. Okay.
Was that just to say that you'd like a recommendation to be made about focusing on reducing inequalities?
Yeah.
Yeah. Thank you. Yeah, we'll finesse the word in there, Councillor Hanif. But yeah, I've made a note of that. Are there any other questions about public health at this moment in time? I am going to use my prerogative of this chair to ask a question, Councillor Goddard, if that's okay. Oh, your time in the hot seat is coming to an end, so we'll be okay. I think I would like to share a reflection just from my own work as a ward councillor. Just before Christmas, I helped an older resident challenge a decision about her benefits. I'll be very careful. I'll be very careful. Don't you worry. Thank you. But what became clear to me in this case was it would have been really helpful for this resident to be able to speak to somebody face to face. And what I'm wondering is if any consideration has been given towards reinstating a welfare rights service now that the council finds itself on a surer financial footing.
As you'll be aware that we're still obviously doing the remodel at the moment of public health, as we are of the council as a whole. So that is something that we will always monitor, and if we feel that we can, then we will.
Thank you very much, Councillor Goddard. I know we're due to receive a report on that service in due course. I'm sure there'll be plenty of opportunity to ask further questions about that. So at this stage, unless there are any further questions, of course, sorry, pardon me, Councillor Westwood.
I'm hoping this is the forum to raise this, but I've been looking at the spans of control in public health. The two that jumped out at me was the emergency preparedness to plan for and respond to public health emergencies, and also the local authority role in health protection. I just want to raise some issues that we had at the local hospital last week, especially following the inclement weather. All the trauma and orthopaedic surgeons that I work with were all in agreement that what we dealt with last week was absolutely unprecedented. I was trauma lead myself for over 20 years until a few years ago, and we've never known anything like it. Last Wednesday, in one operating day alone, we had 5 theatres all day completely devoted to trauma and orthopaedics alone. So that meant, aside the one trauma and orthopaedic theatre, 4 theatres had to cancel full day elective lists. This was all due to people coming in through A&E. We've done a quick audit. They were all asked how they incurred injury, and all of them were slips on the ice, in the snow, etc., etc. So we're still collating the evidence at the moment, but up until this point, we had 64 admissions through A&E in the 48 hours after the first snowfall, 47 of which all will most likely require surgery. So they will be having to be followed up in the weeks to come. So that will take up beds and lists again. We're still dealing with the backlog from the first lot of inclement weather. So obviously I was asked to raise the question, and I just hope this is the forum to raise it, because this is coming from consultant surgeons at the local hospital. They were quite concerned because we've not dealt with that amount of surgery in one time for like before. It's unprecedented. So we're just wondering as well, with the link with like the grit bins being removed and everything and stuff like that, because we've got evidence to collated now that all these patients actually came in because they'd slipped on ice. Okay.
Just before you respond, is it okay if I ask a quick point of clarification, Councillor Westwood? Do you have any information about the demographics of the people who were coming in for treatment? Were they generally people over 65, or was it all ages?
I can confirm that's all ages, and for people in their early 40s to come in with broken hips, it's very, very rare.
Can I just kind of like...
Yeah, that's fine. If it's not for this committee, that's okay.
It isn't for this committee. We are discussing the budget. However, obviously, you know, there are always going to be falls in this weather. I'm not excusing anything. The grit bins is nothing to do with public health. However, You know, perhaps this is something that within adult social care we can review with. I know that we are looking at a cold weather framework moving forward into future years, and we can reevaluate the falls, because at this time of year, obviously, you know, we can't play God. Snow comes, unfortunately, and you know, I've slipped over myself umpteen times because I'm just clumsy. I don't need snow, I just fall anyway. But yeah, without that sounding flippant, Martin.
Just to clarify, the reason why I asked Councillor Westwood for further information whether there was any particular demographics, because if there was a link between the older people,
yeah.
that, but I totally respect that. That is a question probably for another committee.
Okay, but just let me just quickly come in. I would love to have the data from you and the ages and stuff so we can look at it properly.
As you can appreciate, we're still collating that evidence to make sure it's accurate. This was just a quick sort of look through the admissions and the reason for the admissions. But as I said, having worked in trauma orthopaedics at Russell's Hall since 1997, I can verify that what we dealt with last week, due to inclement weather, it was unprecedented. We've never known anything like it.
Education regarding correct footwear and all the stuff sort of thing needs to be put out there a bit more, and perhaps we can do some form of promotion of that moving forward. But I would like to see out of this forum some data so that I can move forward with it and try and help more.
Just to kind of close up on that, because as noted, it's not really a matter for this committee to discuss, but I think it would be helpful if, when that data is verified, Councillor Westwood, I think it would be really helpful for us all to see that, and that perhaps we can look at some messaging to help prevent the slips and falls in wintry weather. Just coming back to public health more widely, was there any other comments people would like to make? Any other questions? Okay, well, at this stage, I think it would be helpful just to recap some of the conversations that we've had, and perhaps start to think about some of the recommendations that we might want to make as a committee to Cabinet. So I think just reflecting on the discussion.
Yeah, just to say, you know, we've still got some more to present on. I've got some stuff to put on there before we make any.
This is just the recommendations for public health and adult social care.
Yeah.
We'll come to you, Mr. Councillor Little. You don't get away that easily, I'm afraid. So it's just to reflect on the discussion we've just had, and it's to note the new personnel that joined the council, and the new cabinet members, and just a focus on the fact that we've been embedding a new way of working in the directorates we've heard from. So just to recap on the conversations we've had around adult social care, I think there would be, just to pick on points raised, it'd be good to understand some of the demand around forecasting and reliance on ONS figures, whether, if I'm correctly surmising there, whether it would be any opportunities to develop any local data. Important, and also I think there was a big discussion there about recognising the importance of transformation more generally, and how that is putting us in a stronger financial position as a council looking forward. And I just wanted to pick up as well at this juncture, for talking about adult social care, that Councillor Baton raised some really good points about our workforce. So it'd be good to see the reflected in the budget how we're going to tackle the upwards trajectory at present of increases of absences for issues related to stress and other mental health conditions. Turning now to the conversation that we've just had on public health. So I think there was a really important discussion about smoking, and specifically about how the council can do more to address the issue of electronic cigarettes and vaping, and particularly its prevalence amongst younger people, taking that up, who maybe have never actually consumed any other tobacco product. And within that, I focus it on a partnership working across the borough. And I'd also like to note the contributions from our Chief Executive, who highlighted the excellent work of our training standards team and other partners in law enforcement to close down some of the counterfeit products that were being sold in vape shops and other products which weren't suitable for public consumption. And just another key part of the discussion we've had so far on public health was the the setting some targets around the Live Well and Age Well programme. So it'd be really good to see the Cabinet be sending some targets around that with some clear KPIs. At this stage, if I have forgotten anything, please do chip in here. But looking at this, looking at the summary so far, I think also just picking up on a point which Councillor Henniff made, it'd be good to see some focus on how this council is going to be using the budget allocation to help reduce inequalities across our borough. As we know, there are quite a big disparity of life expectancy across the borough, so we need to be closing that gap. So that's just and then obviously we did note, although it's not going to be part of our recommendations, we did note the discussion about the recent inclement weather and the increase in presentations at A&E for slips, trips and falls, but that's we picked up outside this committee, and perhaps we'll have that data be noted, but that's not a recommendation. So at that point, we will, Councillor Lewis and I will meet to firm up those recommendations and tighten up that wording. That's just a quick rattle through of the discussion so far. Is there anything else anybody would like to add at this stage? Okay, that's great. So we've actually covered 2 out of 3 of the sections at the moment. So at this stage, if anybody would like to have a comfort break, we've actually got through that rather quicker than I expected to. So if everyone's happy to carry on, we can. But if not, I'd be very happy to allow a 10-minute adjournment break for everyone to grab a cup of tea or anything like that. Some good leadership there from Councillor Bevan. I'm happy to do that as well. Thank you very much. Okay, in that case then, can I bring over to you, Councillor Little, to present the budget proposals for children and young people.
Thank you. All my energy was about to drain then, Chair. I was thinking, I'm going to have a break. I'm just sort of gearing
Get on
myself
with
up.
it then.
I'll get on with it eventually. I'll get on with it. Just an observation before I sort of go into the children's bit is that this evening's purpose is the budget scrutiny. And what I have heard and witnessed tonight is a lot of normal scrutiny, great questions coming forward, asking relevant stuff. And that's really important because with the investment that we've got within adults, children and the public health going forward, it's allowing us to be able to do that work. And some of those questions that you are asking there, with the exception of perhaps the last one, as important as it is, but that's ongoing scrutiny work. And as we've all been doing over the last couple of months with the LGA lead about how we shape our scrutiny work going forward, some of those great questions that you've been asking tonight are the things that you need to be holding us to account over through this investment. The council is putting investment in with desired outcomes, and you've been asking for a lot of those questions and assurances about those outcomes, and part of that answer is the gift within your doing to make sure that you're asking the right questions of scrutiny of us in a collaborative way. So developing that work stream, so was what we're talking about tonight, the investment and not the cuts in these areas in its portfolios, is actually delivering the outcomes we intend them to do. That's just a really important thing I wanted to underline just before I talk about the key budget points for children's. So you mentioned earlier on as well about the huge amount of investment, and I know it was probably not an intentional word that you used there, Chair, about burden, but I'd look at that about investment of money that goes into adults and children, because with the right investment, the outcomes can be delivered in a positive way for all of our children, families, and the wider area of Dudley. So you'll notice through the slides already circulated that the net general fund budget has been increased in children specifically by £12 million for the coming year. That's up to £99.2 million. That's a lot of money, more money in adults. And so the whole restructuring, and why I mentioned it earlier, of preparing for adulthood, children's and adult and public health, having that life journey of a child going all the way through is really important, because they're not separate budgets. They're not separate outcomes we're seeking to deliver. They're the same. And that's why we've realigned and got these being delivered the way that they are. We have noticed, and why we've got that investor save, is a very significant ongoing pressure from the high cost of external residential placements and the rising numbers and costs within SEND, is why we are investing in those areas to reopen our residential care homes, invest into fostering. So we're bringing our children from who are currently outside of the area back into the Dudley area, which has the benefit on the children and families, but also consequently has that benefit on the budget that we're talking about. And that's because there is a huge inflation on placements and foster care that you can see that in the slides that have already been circulated, and that growth and demand, unless we intervene and do something about it, is only going to grow. So we are focusing children on the main key priorities, 4 of them, as you can see up there. You'll have heard me talk about this for those of you that are on this committee and on corporate parenting, is about increase the number of local education placements for children with SEND. That's sufficiency. Have we got enough places for our children to receive what they need in the mainstream school settings where they are? And so we're not having to outsource that responsibility of education to other areas, and making sure that we've got enough placements for our children getting the right results in the mainstream school. And I'll example that by a few things that we're already aware of, where we've got the Unicorn Centre already delivering provable savings on the future projections of how we can deliver the needs of children with SEND from within a different way. We've been facing high costs from external providers at the moment. So we're also looking at the sufficiency of local placements to meet the needs of children looked after. So that's not about where they get their education, that's about where they lay their heads at night and where they are looked after and brought up. So that's reopening our children's homes and making sure that we've bringing children back again into the Dudley Borough and delivering those much needed services from within. There's also that increase in the percentage of workforce that are permanent, experienced and appropriately trained. That has huge consequences for all areas of children and across all areas into adults as well, because if we can recruit and retain our staff, quality can improve. And it is with that oversight and experience that we can, our staff who are out there in education or in social care services can deliver a much better service to the families and children that need it. And the other key priority is ensuring that the Directorate is prepared for the ILACs, the Inspector in the Local Authorities Children's Services. So again, that just is the underlying, that is the method of all those things I've just spoken about. If we've got that right and our investment and scrutinised effectively through this committee is done right, we will be able to get the stamp of approval for that. And that will be part of our commitment to providing consistently good services for Dudley children and adults as we move through this. So briefly touch on some of the next slides there. I'm not going to sort of read them in detail because you will have, these are just a repeatment of the slides that you've already had. The service forecasting overspend there on P8. This is again attributed to the high numbers of costs in external residential placements. I've already spoken about that, how we're investing to try and reduce those down. We've got the significant investment in local internal provision for children in care. Again, I've spoken about that. And the restructuring, which I mentioned earlier on. So I'm not going to, I'll finish off with the last one though, to just draw a line under all of this, is that we are still waiting for the SEND white paper, which was, I believe, due last summer, last autumn. I understand there are reasons why that's been delayed. I'm not going to take snipes at it. It's something that we've got to get right first time. It's a complicated and very impactful thing for the whole of society, not just Dudley. But we are dependent on that outcome of that reform, and we await with bated breath on what it looks like from a financial point of view, but more importantly on how it improves the circumstances of children and families, parents who need that support going through their young life and preparing for adulthood. So I think I've summarised everything that I needed to from children's there, and I'm happy to take any questions, Chair.
Thank you very much for that presentation, Councillor Little. Over to you, Councillor Bowton.
Thank you. My question is around the slide on the new use savings, new use for former children's homes. Reading the narrative on there, the way and I might have misunderstood this, but it would appear that we will retain the building in the ownership of the council, but that we are commissioning providers in order to deliver those services. Have I got that right? Or am I?
Yeah, I don't think you're right, but that's in a nice way, and because I know you don't want that to be right. We will be maintaining that running even ourselves.
But that was my point of clarity, because that was my original understanding.
Was that the bit where it talks about the 50? Is it 50,000 or something?
Yeah, yeah. So,
I'm not sure of the technical side of that, why the money might be better there, but the principle of looking after our own children, I completely get and support, as we both do across here. The technical bit about where that saving comes from, I'm not sure.
So the reality around that saving is it's not a new saving. It was one that was agreed when the 25-26 budget was set. So you made that decision 12 months ago. When we've looked at the budget for 26-27, we've looked at the savings in the round, but we've also looked at growth. So that saving will be delivered in the context of children's homes provision, but recognising that we've built in an awful lot of growth to support the opening of the 2 children's centres. So I know it's really confusing, but it's because it was already baked into the budget, so it stays. But what we've done is we've said, but actually, what growth do we need and what funding do we need to support that? And it's almost netted off by the growth that's being built in.
Any supplementaries, Councillor Bowton?
thank you. That gives me some clarity and some assurance, because I had quite a panic thinking, oh my God, we're going to be outsourcing the delivery of this and it won't be our own, because then that impacts on your savings that you can make. So thank you for that clarity.
Yeah, that's where the technical side of it. I mean, I couldn't have answered that technically, but I know the principle wasn't where we were going with that. Thank you.
Councillor Dale.
Yeah, on a similar thing. Obviously, the size of the homes. I'm aware of a couple of homes that are looking to be reopened, but I guess it's kind of a loaded question. First question is, can you kind of give me some guidelines and kind of outline in terms of the size of those homes and the beds of those homes?
So before I sort of ask for some further, perhaps John will have some details on it. I know that having visited the one we've currently got at the moment has got 3 of our young people in there. There is possible, and you and I have already had conversations previously about this, and I know your concerns, but there is capacity for increasing the number in there. What we won't be doing though is going to a level where it's not delivering the best outcomes for children. And I know that's the key thing that you're asking about there. We've got to strike the balance, but primarily under my stewardship and John's, it will be about quality. We're doing this to invest for children, and where we can get the most bang for buck for taxpayers' pounds, we will, but we won't forsake quality on that and have too many children in there, because that's not the right thing to do. Hopefully that gives you an answer. If you want any detailed further stuff, we can either give it you now. I think across the 2 homes, it's 11 beds. So across the 2 homes, 11.
Perfect. So I really was just to kind of reflect, I guess, the conversation that me and Wayne had previously, and to make people aware that our neighbours are building big homes that Ofsted are declining to allow them to open and invest in millions of pounds. These homes should be a home setting, something that is not like a regulated institution. So I think the fact that we're not making those mistakes. I mean, Shropshire have just invested something like £4 million in a home. They're being told that they can't open in the way that they've opened. They're looking to open it. So the idea that we're not going to make those mistakes and burn through that money, I think, is really good.
Yeah, through you, Chair. The purpose of these homes is the word home. They need to be a home. And when I visited our current home up there with one of our young characters that's in there, it felt like a home for them, and that's what we want to repeat. But the consequence of that, in having them at home in Dudley, looked after, they're one of our own, is that it will deliver savings as well. And tonight's about the budget savings, so it will deliver savings, but it is about delivering those positive outcomes for children first, and we'll give them the last penny, as Councillor Ridney would always hold me to account for.
Councillor Ridney.
I've got to say, it's good to see that we're investing. As you know, I was highly critical last year, and I still stick to the principles I said then. Last penny needs to go on kids, but we are investing. With regards to the homes, this is something that we collectively, as the council, as elected members, have been asking for a long time, that our children are kept within the borough. One, because it's good for them to be still in their home borough, near their families, near their friends, near the schools that they know and the areas that they know. I've always felt that it's wrong to just take children up, dump them in another area and expect that they're going to be fine. I had many arguments with directors of children's services here over taking kids up, saying, why aren't they achieving in this school? Because you're taking them out somewhere they know and put them in a completely strange. So it's better that they are here in our borough being looked after by us. And it's good to hear that we are looking for homes, not institutions, to put them in, which I think is what Councillor Dale was referring to. They should be homes. We should base them on homes. I do have a question. Well, not a question, just a question really, about the children that are still being placed outside of borough. Are we hoping to reduce even further? I mean, I don't know what our plans are yet, because we're still working on them, aren't we? Do we want to reduce the numbers further? And how many children at the moment have we got outside of the borough? And what sort of costs are we looking at for those children? Because I believe it can cost quite £6,000 a week for some placements.
Yeah, you're absolutely right. They're expensive. It forms part of our high level strategy of making sure we've got our children in Dudley receiving that care. The specifics, I'll come to John in a second if we need to on those. But currently, we were discussing this morning, we've got 66 external at the moment. They will vary in cost dependent upon need for each individual one, as you know, Councillor Ridney. But if you want to, through our ongoing discussions, I can share that information and anyone else who needs to know. But it's significant. We took a lot of data and stuff to Cabinet to get this improvement before Christmas, to show the real need for it. But with the investment in homes, with the investment in foster care, and the investment in workforce, and the reason why the workforce is really important is so that they know, our workforce understand where it is best placed for that particular child, in what type of family. So that's where fostering comes in as well. Our staff being able to step down care from wherever it might be a residential care home and finding them somewhere in a more permanent home setting, fostering. So all those things come together in order to reduce that down. I wouldn't be beyond, let's walk before we can run in terms of opening residential care homes. Let's get our workforce up to speed. Let's get them excellent at what they do, providing that care for where we do need to have children in residential care homes. But let's also not be shy that in the future, if there is more sufficiency needed in that particular area, once we've got that competence and confidence under our belt as a council, that wouldn't be off the table for me if it was the right thing to do. Hopefully that answers your questions, unless you want any more detail.
Thank you very much, Councillor Whitney. Do you want to follow up?
I want to do an advert really, being as we're on the telly. Please, if you're interested in fostering, please get in touch with us. There are children that need homes, although we're talking about children's homes, it's nice for them to be in a home with a family. So if you're interested in fostering, please get in touch with us. We're open. I don't know what number there's a number on the website, is there not? So please, if you're interested in fostering, do come forward. They are our children in Dudley, and I'm sure they would love Dudley parents. So please come forward. I'll get back to my questions now. That's okay. So I know I've done the advert.
Chair, can I just follow up on that point? Because we're a double act here, obviously. But it's really important, before you ask your questions through there, that just to give an update. Join Dudley's biggest family. That's our motto. We look after our own. We've currently got 23 new families that are going through training, awaiting that registration and all the checks that they're doing. And you know, I hope as a committee and as corporate parenting, those that are on that as well, we will make sure that those families really feel the support and love of this council. 23 families that are coming through, and we've got big aspirations for more as we go through there. You know, fosterers are a special breed, and we are unfortunately losing some of them through time and age. But what we're also doing is not letting them go. We're keeping hold of them to provide a support network. You'll all have heard the saying, it takes a village to grow a child. So we're taking that, and so whenever our fosterers are getting to an age where they can't continue fostering, we want to keep hold of them so they can mentor, support, and give that help to the new foster families that are coming along the line. And we are having some exciting new offer for foster carers, where we'll be talking about things like reductions in council tax, in support for things that make it more of an appealing thing for families to come along who've got that ability and extra love in their hearts to be able to give a family for our children. Thank you. Sorry, Chair, I'm just...
Okay. I mean, I hesitate to repeat your own advice to your council a little, but if we could just stick to the budget for the rest of the meeting, that'd be fantastic. Thank you, Councillor Ridney.
Yeah, but Chair, fostering is very important. Our children come first, never mind the budget.
I allowed it, but I just that one.
You know my view.
It is our budget. It's our budget strategy.
Yeah, but just to continue, I reiterate what you said. We are waiting for the announcement from the white paper on how we're going to look after in the future our children with special needs. We don't have enough places, but we are doing the best we can, and it is quite difficult. I know, because we've scoured everywhere, and we're looking for buildings that aren't in use. But it's important that we do remember, and we are also looking to see what the new budget will be. Although I know you set a budget for this year, but hopefully when the white paper comes, we will also have some good news from government on, well, wiping away some of the debt that's been in time, that's we've managed to get into. But that's every borough. It's not just us. It's not just Dudley. It's right across the country. So it's important that we do continue to invest. Like I say, I can only say that this is a better budget than we had last year, but it's also trying to look after our workforce. As we've talked about earlier, we need to care for our workforce and reduce those workloads that they've got, those cases. But if some of those people just, you know, they don't want to lose their cases, do they? They want to keep supporting, and that's a good thing. So I can only say that it's a much improved budget. Hopefully the impact on our children will be good. But it's up to us as a committee to scrutinise that and to make sure that that's what happens. Those children's homes need to come online as soon as we can. I know I ask you every time we have a briefing when that's likely to be. It's getting closer. It's getting closer, but hopefully it will be within the next 6 months. You nod? Yeah, next 6 months.
So all I would say in response to that, if I can, Chair, is of course all homes for children are subject to Ofsted registration, and that can be 6 months, and you need to have all the staff in place that you have to run a home, plus the building needs to be fit for purpose. So we're doing all of that stuff now ahead of the application for Ofsted registration. So they will be open as soon as we practically can open them, Councillor Ridney.
Any supplementary questions, Councillor Ridney, or comments? Okay, I'm going to, she's been sat here very patiently. I'm going to hand over to my Vice Chair, Councillor Lewis.
Thank you very much. I just need some clarity. So under the general fund budget 25 to 26, education, inclusion and send, you've got a figure there, 0.624. Can I just have some clarity on that figure, please?
Just bear with us a second. We've got the big, this is the big slide you're returning to.
Yeah,
the big
please,
packet.
sorry.
Yeah.
I haven't got the detail in terms of what makes it up, but it is actually an underspend on that budget. So that's really what it's showing. The pressures are elsewhere in terms of placement costs, which is the line above. And then we have got some small savings in education, inclusion and send. But I think the main pressure, particularly on the send budget, is contained within the dedicated skills grant. So this is almost like the operational budget, but then we've got a budget within the DSG, which has already been referred to, is under significant pressure, and we've got a cumulative deficit on that. And that's something where we're looking to the government to tell us what will happen between now and the statutory override ending in 28-29.
Okay. Thank you, Lisa. Can I just ask one
may.
more question? This is to you, Councillor Little. Right, the government strategy for improving child development and meeting the ambition that 75% of our 5-year-olds need to, in England, need to have good level of development by 2028. I would love to see some investment into this area, and I would like to maybe see that in a key priority as well, please. It's okay.
Yes, and I know this is a point close to your heart, and of course, all of us operating in this area completely agree. It's the upstream investment in making sure that we get them at a good level of development. That also gives us the opportunity to recognise any special educational needs as they may progress. I remember visiting a school. What's the one next to the source called? Down in Kingswinford. They just got outstanding down there. For the name misses me there. But speaking to them down there, that really early level in nursery and early years, you know, I know you're aware, you operate in that area yourself, and how important it is that our children get that good level of development the first 1,001 days. That's absolutely key. There is investment, of course, we're going to put into that. John, you said something to me.
Education strategy.
So yes, yeah, that was reminded me. So we're currently undergoing an education strategy, which is from start to finish, all the way through. That links into preparing for adulthood and across there. So these things are being picked up. You'll notice as well, we've spoke about the dedicated school grant and that money, the pressures that are within it. But I think it's worth really noting that we're elected members here, and the people that are making all of this happen are either sat behind me, some of them, or they're out there working in children's services or adult services. You know who I'm talking about, one of our lead SEND practitioners who's out there scouring Dudley for buildings that we can turn into that provision to help in early years into our SEND provision. That is an active thing that's going on to give us further examples of like the unicorn, where we can get our children to that good level of development, get them into mainstream school and make sure that they have a fulfilling life, not in an alternative provision if not necessary, but certainly in our mainstream schooling through a great start in the early years. Hopefully that answers your question and gives me the ability to showcase a bit more.
I think it was the Phoenix you were referring to.
Thank you. Thank you both. So, Councillor Hanif, you indicated you would like to speak.
Yeah, thanks, Chair. Talked about one of your key priorities is to increase the percentage of the workforce, and I know you touched on workforce, on fostering and the areas of send and so on. So if I can just sort of and you mentioned that it's a priority for the following years. So if I can just ask you some direct questions, like what is the current vacancy rate? And if you're aware of any agency spend that we are making at the moment, and any ideas of what sort of caseload the social workers are having. And also following that question, how do we compare statistically with neighbours? So what are the plans to reach the top quartile?
Yeah, thanks, Councillor Neath. So you talk about their vacancy rate and caseload and agency, I think was the other one. Did you mention agency? Yeah. So currently we're sitting at a level of, certainly in social care, children's social care, where we've got agency usage of around 22% at the moment. That's not where we want it to be. This is so you're absolutely right in flushing out that what is our commitment to workforce development. That is it. It is about, first of all, bringing it down from agency. Our ambition is to halve that figure. And again, I'll remind you that as the scrutiny for this, it's for you to hold us to that and make sure that that's something that's achievable. Or if it's not, why not? And how can we improve it and come up with other innovative ways? So agency, that's what it is, and we've got an ambition to remove it. Vacancy rate and caseload, I'm aware of some of the caseload numbers, but I'm going to pass over to John there because he can give you some more detailed information on that one.
Thank you, Councillor Little. So the vacancy rate in children's services is about 6%. So that's the posts that are unfilled. So as Councillor Little said, we've 22% of the social care workforce are agency staff. And then the average social care caseload is about 20 to 22. It varies. We monitor it every single week. Positively, the council has a commitment to reduce that caseload down to closer to 18, but that requires the permanent workforce, because one of the challenges around agency staff is it can be more volatile. So they come, they can stay for a few months and then they can leave and you've got a vacancy. So your caseloads can go up while you fill that vacancy. Whereas a permanent workforce, much, much better for children because you're telling your story once, you build a relationship with the family, and it's also better for the council's budget.
Any supplementary, Councillor Neath?
Yeah, just quickly, are you aware of sort of workers that have caseloads above the recommended level? Where?
Yeah, thank you. Yes, so I track every single week the caseload data across the teams of children's services. We have a weekly sort of quantitative output performance email that just gives me the sort of headline figures of the numbers of children in which category, the number of workers across each teams, and their average caseload and whether it's going up or going down. So I absolutely monitor that every single week.
And just to add to that, Councillor, we get shared that as the lead member and shadowed as a weekly scorecard, as John talks about there, that's sent to us. So we're aware of that and monitor it.
And just another follow-up, yeah. So is this like adequately managed then, where loads are high when you looked at these figures, the plan? So if somebody was, heavily kind of, it was above their normal, so what's the action plan there then? How would you?
So the service director in children's social care, which is primarily where the pressure is, holds meetings with heads of service to try and manage put through the system, because as new work comes in, you have to manage work to step down or to exit the system. So they work on how you can safely achieve that for children. So for example, a child might be subject to a child protection plan or a child in need plan. Could they be stepped down to an early help service? And therefore that frees up the social worker to take on a new case coming through. but it's monitored through the service director weekly. And as I say, we get that weekly email.
Just quite mindful here of the steer we got from the cabinet member about trying to keep to the budget. So by all means, ask another question, but just want to keep the conversation focused. Anything else?
No.
Councillor Dale.
Yeah, it was just around the staffing and the fulfilled vacancies. In the interest of obviously looking at keeping obviously costs down over a longer period of time, I know I've banged the drum for upskilling junior members of staff since I think my first corporate parenting committee. I've done most jobs in a local authority, from family time worker to family practitioner to trained social worker. There are staff members that sit in and around the teams that write notes for court that have got these abilities to be able to do some of the jobs that I guess we're probably looking to outsource, that we could upskill, maybe save a little bit of money on the interim period of time. We don't have to go and source those people because the talent pool in the Midlands tends to be quite limited. And you find a lot of people move around, which I guess reflects on our budget on a longer period of time. Therefore, we're constantly sourcing the same kind of roles. Is there going to be any look to maybe upskill those more junior members of staff that we do have within the council?
So great question. Thank you. So last week I met with our corporate HR lead so that we develop a corporately owned workforce development strategy that will address the challenges for children's services. That will include Grow Your Own, which is the sort of programme you're referring to, a children's residential home academy, social worker academy, etc., etc. But it will be, well, my vision is it will be putting Dudley on the map to say Dudley Children's Services, go in places, come and join us, be part of making a difference for Dudley's children. And also, one of the other things is, can you see your career progress? So, for example, when we meet the new academy graduates who are joining this month in January, they'll come and meet with myself and the service director, hopefully the lead member, and we'll talk about see your career develop with Dudley. So don't just think you come and you have to go somewhere else to progress your career. See yourself becoming the Director of Children's Services in 10 years' time, and how do we build the programme of support around you with our corporate colleagues so you grow and develop your professional skill set, but also your managerial skill set as well.
Would you like ask any supplementary questions, Councillor Dale? Councillor Baton?
Just on that, is there an income generation opportunity? So that once you have got your academy ideas up and running, that actually they become a good practice model. So therefore, we could have the opportunity to generate income from other neighbouring authorities who may want to buy in the expertise.
So there are other examples of academies across the region, but I'm absolutely comfortable with looking at how can we look at income generation around our own arrangements. What can we do to sort of become the, if you like, the jewel in the crown of the West Midlands? Why couldn't we? Why shouldn't we? That absolutely has to be our ambition across a reasonable period of, say, 3 to 5 years.
Can I add in on that as well? I think it starts a little bit earlier as well. So we need to put the we mentioned briefly earlier on about the education strategy of Dudley. I'd like us to have like key themes that we want to, when we're talking about growing our own, it doesn't just come as a workforce. That comes from the Trailblazer, that comes from schools, it comes from like careers partners where they're talking. We've got a number of fantastic providers at sixth form and beyond with the new Star Academy coming into Dudley in the future. Making sure that our children who are currently in perhaps, I don't know, year 6, 7 now, what are their aspirations to work for us in Dudley in these sectors, whether it be in social care, education, SEND, all these areas. So it starts up front as well within our education strategy, which we are currently producing.
Anything else, Councillor Baton? Okay, I'm looking around the room to see if there's any other questions. In that case, I will use my prerogative as chair to ask 2 questions. So first of all, a note that a whole series of discrete grants have been rolled into the Children's, Families and Youth Grant. Also a note with approval that the overall level of funding compared to last year is going to increase significantly. And it will be more for the next couple of financial years. However, there is a slight reduction in 27-28 and a further reduction in 28-29. Is there a particular reason for this? If that's helpful.
Yeah, so all I can say is that it's been a really complicated settlement in trying to streamline the number of grants that we receive as local authorities into a smaller number of consolidated grants. The philosophy behind that is really welcome. But actually, the reality of trying to unpick it and to follow some of those things through and to look at the rationale has proven to be really, really difficult. And we're still going through that, as are a number of local authorities. So we're not alone in this. So I can't give you a full comprehensive answer today. All I can say to you is the work is still going on in terms of understanding what grants have we got in this current financial year? How do they map across into core spending power and also into those new consolidated grants? And then understanding what formula has changed and has driven a change in the allocations. So in a few weeks' time, I might be able to give you more. All I can do is we can present the information that we know at this point in time.
No, I'm appreciative of that. Thank you, Lisa. And also, I'd like to state on record, on behalf of the committee, the thanks to you and your team for the work you did putting together these reports sort of the end of last year and over the New Year period where many others were taking a break. So thank you so much for that. So just on to another question, and it's a cause which is, I think, of great importance. Am I right in thinking that the Holiday Activity Fund previously would address the issue around holiday hunger? As we know, some of our children in our borough, the only hot and nutritiously balanced meal they might get in a day is when they're at school. So making sure that young children, young people are well fed is obviously important. So just wanted to make sure that was going to be covered in the budget going forward.
Yeah, again, that's one of those issues that we're seeking clarity on in terms of how that funding can be used. We've got a new crisis support fund that's come through with new criteria, and it literally just dropped last week, and we're working our way through. We intend to use Scrutiny to come through later on, and we've got to obviously set a balanced budget within a statutory time frame, but that we're not going to have everything sorted before then. So that crisis resilience fund is one example. So we build it into the budget, but then we just need to make sure that we're looking at the new guidance and what that scheme and everything associated to it looks like. And we'll use Scrutiny as part of that process.
Understood. And thank you, Lisa. Would anybody else like to comment? Councillor Little?
Yeah, I was just going to, from what I picked up from your question there is about the Holiday Action Fund, the HAF fund. I noted how they were being rolled up, perhaps for some financial efficiencies in the way things are being accounted for, but I've got no understanding or concern at the moment that particular part of the funding won't be to deliver what it always has done. I'm quite sure if that was a concern that anyone else had got, it would be raised by now, and I'm sure that I'll do all that we can to make sure that it's business as normal. So during those holiday times, that's what the funding's for, and that's what it will be delivered on, because there's so many of our partners that deliver great activities over those periods, and I'm sure they'd be jumping up and down if they thought they weren't going to be getting that support.
Thank you for that clarification. I do accept that you can't give all the answers now from the finance team. So thank you for that.
Sorry, Chair, if you may. So, and it was much appreciated in terms of thanks to the finance team, and there's a number of them actually dialed in online. And as a consequence of that, they've actually just pinged me a message, so which is useful. So I can't take any credit for this. But what they said to me is that the HAF does give meals, and that is continuing. It's the vouchers through the Household Support Fund that's subject to the new criteria and information, and that's the bit that we're looking at. So thank you to everybody online for that clarification.
Thank you. Thank you to our colleagues joining us remotely. I knew it was worth buttering you up a little bit. Is there any other questions anyone would like to ask at this stage? Anything else anyone would like to raise? So we've had a really good discussion here, and I thank you for the presentation, both from the Cabinet Member and the Director of Children's Services, and thank you for all your work as well. These aren't recommendations. Councillor Lewis expressed alarm at the notes that the monitoring officer is making. It's just to give a summary of what's been discussed, and I'm going to invite Councillor Lewis and Karen just to stay with me afterwards a little bit to help synthesise some of the recommendations, what's fresh in our minds. Don't look at me like that. We're getting out here a bit earlier than we thought we would, so it's okay. So just to give it a summary of what we've discussed so far, and if I missed anything, please do notify me. So we talked a little bit about the work of providing children's homes and keeping our children in the borough and ensuring that they are homes, not facilities or institutions or any other kind of language that conjures up a less humane space. So that was good to hear. It was also good to hear again about how I used the word burden earlier. Perhaps pressure is a better word. And it's just a note more generally, there's many things that aren't in our control, and that is the impact of which adult social care and children's services does have. But what is within our control, and I think what is worthy of commendation, is the way in which we have tried to keep more children's placements in the borough. So thank you for that. And that is a really good piece of work, which is both saving money and keeping and reducing pressures on family time in terms of commuting. It's not a recommend. We know it's not a recommendation, but we know that with thanks to the 23 families who are going through the training for foster care and providing homes for children in our borough, and I think as a committee we'd all like to offer our support to them as they do that really vital job. With thanks to Councillor Lewis for offering us the benefit of our expertise to raise some questions around special educational needs and the underspend and other issues to do with early years. I think one recommendation we will be looking at is how we can really make sure that we are giving children the best start in life, a bit more of a focus on making sure we support getting that support right in those first few years of a child's life. Note as well the work being done around our staffing rate and also the important contributions and thoughts raised by Councillor Dale about how we can upskill our current workforce to reduce some of that spend around bringing in outside expertise. Thank to Councillor Baton to look at the contributions around income generation in areas such as academies. I won't recap the conversation we've just had about the grants as more work is needed to be done on that. But I just want to take this opportunity to thank everybody for the contributions this evening. It's been a positive meeting, and I think on a whole, this budget is about investment. And we find ourselves through the work collaboratively in a much better position this year and able to make some really positive steps forward. So thank you all. I'm going to do a little bit of work on the recommendations now, but everybody else do have a safe journey home.
Just before we close meeting, just through you, Chair, just to wrap up for the purpose of the committee. So what will happen in terms of next steps, that as the Chair has outlined, we will work on the recommendations. So from a formality, delegated authority will be granted to the Chair in consultation with the committee. Recommendations will be shared and they will then be passed on to Cabinet. So if the committee is happy with that, if we could just confirm the resolution in respect of that.
Thank you very much. Thank you, Aftab. So we'll do some work on the recommendations, try and put them in a sensible order, and then we'll circulate them. And just to say that vice chairs and chairs are meeting on the 2nd of February to collate recommendations for Cabinet. But with that, thank you all very much, and do have a safe journey home.